Good afternoon, ladies and gentlemen, and thank you for joining us today. I'm joined today by Dr. McNeil, our Health Authority, David Gonzalez, our Health Department Director, and Mayor Riley McCoy. We appreciate you tuning in. Today, we have 3 confirmed cases of COVID-19 in Victoria County, same as yesterday. To discuss those cases further and to provide some additional clarity for the community, everybody here will be making remarks today, and we'll begin with David Gonzalez down at the end.
Great, thank you, Judge. Good afternoon. I just want to provide a little update on the 3 confirmed cases, as Judge mentioned. Currently, the epidemiology team with the Victoria County Public Health Department is currently working on that investigation. The initial part of identifying the high-risk contacts with those cases has been completed. However, there continues to be investigation into the low-risk contacts, and in the coming days, we'll be releasing information when it comes to that. Also, I know there's questions as far as the public wanting more information, very specific information on these cases. Keep in mind, I want to remind folks that these are still patients, so they still have privacy, and we abide by that, and we defer to the HIPAA regulations to protect those patients' privacy at all times, and we ask the public respect that as well. Keep in mind that we will provide as much information as necessary to protect the public and the public health to make sure that is of utmost importance. One thing we've talked about in the past is, I think last week at one of the conferences we touched on the strategic response guide. We had the graphic up here going into the different levels as this response, progresses. One thing that we discussed previously is we're right now on the actions, we're ahead of the situation. The actions we've taken at this point have been a step ahead of where the situation as it unfolds. Currently right now with the 3 cases, we're already at the actions that we'd be where we had mild to moderate transmission. So we're confident in the point we're at in our response. That may change if we start to see more cases, if we start to progress into moderate or widespread transmission, and that's when our actions will obviously follow those current situation at that point. One thing I also wanted to address today was the specimen collection site that we have at the community center. As we mentioned previously, Tuesday was the first day for that site to be open. It was open from 8 to 12 on Tuesday. I think it went well. We did, I think we did actually collect 5 samples that day. We weren't expecting to have a heavy load of traffic there that day, being the first day, and didn't have a lot of time to schedule. We'll be open again that site on Friday morning from 8 to 12. Keep in mind that process requires you to have a specific order from your physician to be able to have a specimen collected at that site. So if you're a patient and your healthcare provider deems it necessary that you do need a collection of tests performed, you may do that. They'll need to submit that to Citizen Medical Center Central Scheduling, and your healthcare provider should have those instructions on hand to be able to get that process in place. Keep in mind, we're only open 2 days a week right now at that site. However, there's other avenues and other places they can go to get those testing done. We encourage those folks to go to their private physician, healthcare provider, or one of the urgent care clinics here in town. Just want to point out additional resource. CDC has a COVID-19 symptom checker guide, a self-checker, on their website. What that allows is folks to get on the website, go through the different symptoms they may be having, to check to see if they're a candidate who may need to get tested, need to seek further guidance from the healthcare provider. And that's on cdc.gov, and it's under symptom self-checker that you can access that for. If you do, I guess based on that self-check, if you notice that you may, if it advises that you need to perhaps seek medical guidance from a healthcare professional, again, reach out to those healthcare providers, schedule an appointment, call ahead before you go, of course, and then they will deem it necessary if need be for you to have a COVID-19 test. And again, if you are, like we've been preaching or been discussing previous press conferences, if you are symptomatic, please self-isolate. That, as Dr. McNeil touches on daily, that is one of our main, offenses to this illness, is that to protect yourself and to protect the public, you must self-isolate, stay home if you're sick, and practice those common hygiene procedures that we've been talking about up to this point. At this point, I'm going to turn over to Dr. Neal for more updates and remarks.
Well, thank you, David. I just have a few little things to go over, folks. And the first thing, we want to discuss the COVID-19 confirmed cases that we have. You know, we have 3 cases here in Victoria, and it's not a surprise. We've known that we were going to get cases eventually. All 3 of those patients are being monitored very closely, and the epidemiologist and I spoke at length right before this press conference, and she has informed me that they are all very compliant. They're adhering to all of our requests, and they're just interested in public health just like we are. So that's all working out well, and that seems to be going well with their isolation. You know, no one's under any quarantine orders. We haven't done anything like that. So everybody's been compliant. The patients seem to be doing well from what I've been told. I figured someone would ask that. You know, these patients, before, right initially when we're notified about a patient that becomes positive, there's a procedure that occurs, and that's all the contact tracing that goes on. Our epidemiology staff goes through and finds out exactly who they've been in contact with, where they've been, and if need be, we inform the public if there's any danger to them or any concern to them. So everything seems to be, from the head of our epidemiology department, seems to be wrapped up with those as far as their contact tracings being notified and the danger to the public being as eliminated as possible. Now, that being said, it is a fluid situation, you know, and we may find out later that someone else was around them or that someone else was at a place where they were or whatever that may be. And if that's the case, then that will be carried on as well. But just rest assured that everybody is working well to keep these people isolated and use the one strong tool that we have to prevent the spread of this illness, and that is isolation. The next thing I want to discuss is that, you know, the issue of testing. There's a lot of questions and a lot of people ask, well, how many people are y'all testing and how are y'all doing the testing? Well, you know that we now have the facility in the parking lot at the community center, and so that's one thing that we're doing. Of course, the health department is testing, and we've probably done somewhere in the range of 70 to 100 tests. So we've done these tests, and I can tell you that all the ones that the health department have done have come back negative. Now, the positives that we had were done through the private sector, and we've encouraged this. We want the private labs. Why would we not want private labs to test people when we can get just as good of a result? The private labs will report that to us immediately, so we know exactly. Pretty much the minute they get it back, I think there's a statute that says they have to contact the health department within 1 hour. Is that correct? Pretty quickly. They do it real quick. They want us to know. So we get that information, and then of course we pass it on. And that's when the contact tracing begins. That's when the whole process of isolation begins. And even patients, when they're tested, they're told to isolate themselves until we get the results back. Our goal is to keep these people away from other people. I don't know how else to put it. So that's a process that's been worked out really well. As far as the rest of the numbers of testing, I can tell you without a doubt that the local health authority and the head of the health department have no idea how many people have been tested. So there's a lot of tests being done. I was speaking to one of the hospitals yesterday that has done 20 or 30 tests of their own. Multiple clinics in town have done multiple tests. So one of these days we'll know how many people actually got tested. I can tell you that the thought is that there's about 400,000 people in the nation that have been tested, but I'm not sure how they can come up with that number when we can't even tell you how many were done in Victoria. So anyway, on that's that one. The other thing is that basically, you know, we do have levels of enforcement in place to make sure that people that we request to be isolated stay isolated. They're called control measures, and they're basically placed there by the local health authority. I can tell you that that has not been a problem. We have not had to enforce anything. All we've had to do is ask people to basically be compliant, and they have. So we're very happy about that. Ultimately, the public can rest assured that these patients that we are taking care of are under medical review. I spoke with Brittany just a while ago about some things with them, and I mean, we watch these patients very closely. They're monitored every day, and anybody that needs any help will get that help. That's pretty much what I have. If y'all have any questions.
Well, let's, a couple brief remarks, Dr. McNeil, and then I guess we'll open it up for questions
Okay.
at the end.
Well, this is where I would introduce Judge Zeller at that point. There you go.
Yeah, one thing that I wanted to address, to kind of follow up on yesterday, the mayor and I continue to get a lot of inquiries as to shelter-in-place orders. I think that's largely due to the headlines we're seeing from a lot of other Texas communities that are issuing orders with that title on the front. Also due, obviously, to the fact now that we have 3 confirmed cases. But I wanted to try to clarify that discussion. Shelter-in-place orders is a term that's not uniform from community to community. In certain communities, you see things under the name shelter-in-place, stay home, stay safe, stay home, work safe. Some people refer to this as lockdown or shutdown, or lots of different titles on the front page of the document in the thousands of communities across the country, but really the details on subsequent pages is what actually matters. So when you hear that term, it's important to know what exactly it means. What the mayor and I have been looking at is what options are available to us compared to what we're doing already. We want to be absolutely certain that additional steps yield some positive results, some community health benefit. David earlier said it well, we're kind of ahead on our actions. Last week, we had issued what we called the Strategic Response Guide, giving the certain conditions in various levels and then our response in those situations. Essentially, the conditions, the situations that we're now in are what would be categorized as phase 2, where there's a global pandemic identified. We have the presence of community transmission, although minor, and then possibly major regional or state community transmission. All those things are present. So that's the situation we're in currently. But the actions, the response that we're taking, mirror what's in the next more serious phase, phase 3 on this chart. Those things include the disaster declaration, which has already been issued, the limitation on social gatherings, which the mayor and I implemented on Saturday, partnering with our independent school districts to determine what actions they'll take. We've done that. And then also implementing our pandemic plans as employers, city, county, and other major employers in the area. So I think some of the questions we've gotten was due to yesterday we saw something new in terms of severity, confirmed cases, without, it seems, a corresponding next step on our part. What I want to communicate to the community is that that next step was already taken, proactively and preemptively, knowing that these confirmed cases would, in all likelihood, come to our community, and they have. So I think the steps that we have taken, and Dr. McNeil and David and the mayor agree, are appropriate to our current circumstances. Obviously, this is a fluid situation. Everybody's heard that many times. Things are rapidly changing, but we feel that the steps we've taken do match our current situation. Yesterday I spoke about what we did on Saturday. What we did on Saturday was to implement a uniform order, countywide, citywide, that made as a requirement what had been mere recommendations up to that point, and what had been a very ambiguous order from the governor's office. In that order from the governor's office, there was the term community gathering, which wasn't defined. People asked, rightfully so, what does that mean? What does it apply to? Does it apply to my recreational activity, my social activity, my work activity? Many questions arose due to that. So As we stated previously, the mayor and I wanted to clarify for the community what that applied to, and we issued our local order that uniformly applied the standards within Victoria County. When it comes to this concept of stay-at-home orders or shelter-in-place orders, we would want to be certain that any additional step we take doesn't lead to more confusion and questions without getting a community health benefit to it. When you look at many of these shelter-in-place orders that have been issued across the state from both counties and cities, what you see is a very, an order limiting a host of activities in daily life, but then you see a laundry list of exemptions to that order. And you see terms of essential and non-essential businesses, and then an attempt to define those things with a laundry list of definitions which are even more confusing. Grocery stores certainly are always in every exemption, but also other stores that sell groceries are in the exemption, along with stores that sell things necessary to operate a residence. Ambiguous terms, what does that mean? And then there's further exemptions, any non-essential business that provides an essential service to an essential business. Would it make sense for us to issue a similar document in Victoria at this moment? Our opinion is no. We're prepared to expand the order that we have in place if there are specific things that we see and think should be done additionally. But in terms of the community requesting that this be done, we need to be clear as to what it is that's being requested, and also be clear and certain and understand what steps we've already taken. In many respects, the elements and the effect of these shelter-in-place orders are already being achieved with what we've put in place several days ago. I think at the end of the day, what folks in the community want to be certain of is that we at this table are doing everything we should be doing to protect the community from the spread of COVID-19, but that we're not unnecessarily hurting businesses and families that are already hurt amid all these circumstances. We feel that we are on the right track with the response that we have in respect to the conditions that we're under. Clearly things are changing by the day, but as of this moment, we feel we're on the right track. So, again, when you hear that another community somewhere else has issued a shelter-in-place order, but we haven't, the term isn't what has the effect. It's the 20 pages behind that front page, and we feel, looking at all these details, that we are on the right track, doing the right things for our community. So just a few comments there related to that. And again, the chart that we put out a week ago, we have followed and we are adhering to this, and even in our response, we're one phase ahead. So our game plan, we are on track and executing. Wanted to point that out. Let me see. Okay, that's primarily what I wanted to share in those remarks. Again, things remain very fluid. We're ready to adapt and readapt, but I think we're on the right track. I'll turn things now over to Mayor McCoy for some additional remarks.
Well, good afternoon, and I want to echo the judge's remarks that based upon information from Dr. McNeil and David Gonzalez, we did not feel it necessary to invoke any shelter-in-place orders. However, the moment that changes, as I said yesterday, we're prepared to act and have taken measures behind the scenes to allow us to do so very quickly. For those who might ask why the community transmission case has not put us in a shelter-in-place, we used the strategic response guide that Judge Zeller just alluded to. We're on track with that guide. specifically. We're actually ahead of the curve a bit in what we're doing. And we have to remember that this is a fluid changing situation. And it's fluid not only for us in Victoria, but for the state, the nation, and the world. But you have to have your basic plan in place that gives order to our reactions that we ultimately would take. To address those people who are concerned that they might catch the virus from some of the people who are already positive, it's like I said before, you know, you have to take responsibility for where you go, where you choose to go out there. And if you see a situation that you're uncomfortable with, remove yourself from that situation. Because again, you know how you feel about the situation. You know the risks involved. We are constantly repeating those up here day by day. And so be cognizant of those things and be cognizant of them when you find yourself in the situations you do. And the experts are telling us what we need to do to slow the virus, and I'll repeat it again today. It's the same three things for the past 2 weeks now: social distance, stay home if you're sick, and wash your hands. These simple but incredibly effective measures apply equally, whether we ask you to comply or mandate you to comply. It's all the same. The answer is the same. So now, more than ever, it is time for our community to listen and take responsibility for the role they are playing in stopping the spread of COVID-19. It was referred to earlier that the CDC has a COVID symptom self-checker on their website. We constantly refer to the guidelines of the CDC. If you feel bad or you feel like you've been exposed, go there. Understand what these symptoms are using that guide, and if you feel that you may have these symptoms, call your healthcare provider immediately, and they will direct you in what to do. So avoid all non-essential activities yourself. And that is the best thing that we can do as a community to stop the spread and slow the spread of this virus.
Well said. Thank you, Mayor. We can go ahead and open it up now to any questions that you might have for anyone up here.
I'm curious, Carolina from KVU, wondering what would cause us to go into phase 3? What would spur us into a mandatory stay-at-home, or, you know,
Sure.
and also, do we have a local definition of essential and non-essential workers?
Excellent question. The question was, for those listening online who didn't hear it, what would spur us into the next level of severity, to the next category, and do we currently have a definition of essential and non-essential workers? We touched on this to some extent yesterday. We've long said that a trigger point would be local community transmission. I would say, I think the definition we were going on is a moderate community transmission, moderate to severe. But like we pointed out yesterday, that term, and it's not because we're trying to be difficult and not give an answer, that's hard to define in terms of a specific number of confirmed cases, because the details of every single case matter. We are, as a group, looking at our area as our community, not just Victoria County. We're paying attention to the confirmations now in Calhoun County and elsewhere. But we really can't put a specific number on what the trigger point is, because the details of each confirmation are different and the details of each confirmation matter. For example, with the recent confirmation, it would matter how long the test was out before it came back. And in that time, whether it was 2 days or 7 days, who this individual was exposed to, what activities they participated in, where'd they go, who were they around. So it would be a critical factor of how long it took to get the test back and what we found that individual to have been involved in the meantime. that's a factor that matters and is going to vary from situation to situation. So while a trigger point we've all agreed is moderate to widespread community transmission, we really can't put a number on that.
Right.
Is it 6? Is it 12? Is it more? We can't say, because each instance has details that matter, and until we get them, we don't know what those are.
And Judge, if I may
Sure.
add quickly, the definition of that for us, for me, and I believe the judge too, is what our healthcare providers define it as, because they have knowledge that no one else has. They know the severity of the situations, they know more about the patients, they know all of this stuff, that definition has to come from their minds, because they are the most qualified and they are the experts. So we rely on them to tell us when we reach this major or widespread deal. So the definition is how they define it with the knowledge they have and the expertise they have.
Yeah,
Okay.
so moderate to severe community transmission. Dr. McNeil, David, anything additional that?
Probably the most important thing would be when we do that contact tracing is to see, not necessarily where they went, but if anybody got sick where they went. So that would indicate to us that this is taking off in the community, because this is exponential. I mean, everyone that, if they infect 3 people, which is the average for this disease, then it's going to exponentially grow, because 3 to 3 to 3, and that's what we look for. When that starts happening, that is moderate to widespread community transmission, and that's when it becomes a problem.
I think some of the concerns from our viewers include, being concerned about their mothers, their parents working at the mall. Dillard's is still open. And if we locally can define or add, install some protections for our workers that would help contain the spread, I think.
I can see that as being a concern, but here's the thing, is that as far as we know, this disease has spread by sick people. So if people will monitor themselves, and if they have fever, or they have a cough, or they have illness, and if they'll stay away from other people, then that within itself will contain it. We're worried about sick people going out and infecting other people. But really and truly, our trigger for even testing people is the presence of symptoms. So just because you were around someone that had the disease, then what the recommendation is to monitor yourself. If you develop symptoms, then isolate yourself. So that answers your question. That's exactly why we haven't, well, for lack of a better term, closed Dillard's. So.
Yeah, and to the second part of your question, Carolina, was do we have defined essential and non-essential businesses? We haven't done that. If it comes to that, that's very difficult to do, because like I mentioned yesterday, one person's non-essential business is somebody else's livelihood and irreplaceable income for their family. So I don't want to go there. I don't think we need to go there. We're not there yet, but there are additional steps that could be taken by revising the orders that we have in place. We could, if it were warranted, lower the group size from 10 to a lower number, or look at specific types of businesses that you mentioned, but I don't think, based upon Dr. McNeil's expertise, there is a medical need to do that. John, you had a question, sir?
Yes. I know you said that these decisions will be informed by health officials, but ultimately, who will make the decisions about whether or not we go into a shelter-in-place or a stay-at-home
You're
order?
looking at it.
That's the mayor and myself.
The two of you.
Yes, mayors and county judges each individually have the ability to do that, make that decision within their jurisdiction. The mayor has the unilateral ability to do that within the jurisdiction of the city of Victoria. Of course, being that the city of Victoria is within Victoria County, the ability of the county judge encompasses the city, but we've made it a point and have been working hand in hand in this effort so that both the decisions we make and the steps we take are in lockstep with the other.
And I want to reinforce that we actually have unilateral power. If I would make a decision one way, I can make it, the judge can make it. But we have chosen to work together because we think that's in the best interest of this community, and we work and we question one another. We talk to one another about it because our ultimate goal is what is in the best interest of our community, Victoria County. It really doesn't matter in my mind. I think the judge and I look at each one of the people that we serve as people that we serve. And as far as I'm concerned, you will probably see us continue to make consensus decisions, and I think that's extremely important in getting out a clear and concise message to people. And then I'll reiterate a point the judge made. We think it's more effective to do corrective measures on a smaller basis if we see that there's something to do than issuing expansive, more broad things that can be misunderstood. Because I can tell you, there are definitions of essential services that you see in other communities' orders, which we research and we do. But I can tell you, we get phone calls from everybody where we're essential, we're essential, we're essential. So you can see the issue that we have to deal with. But ultimately, what goes on that list and what's decided rests with us, okay?
And I would want to commend and thank everybody in this community who's taking what we have in place seriously.
That's right.
And adhering to the 10-person limit, the advice and direction that's been given for the folks who are adhering to that, because it takes everybody following that for it to be effective. When you're dealing with a virus as opposed to something else, a weak link in people's compliance could undo the efforts of everybody else, which is one reason why in our order on Saturday, we had it across the board, apply to everybody, because that's how we're going to slow the spread of COVID-19.
And I can assure you, I'll echo the judge's sentiments again, the way that people are responding in this community is astounding. The stories I hear of people, my wife, when he goes to the grocery store, the way the grocery store has taken upon themselves to adhere to these measures that we're asking them to do. There is no way that the judge and I could sit in a back room and write a better plan on how they could react than what they are doing on their own. Because they understand their business, they understand the necessity for the limiting people, distancing people. And so I applaud the people in our community that are taking it upon themselves to do what needs to be done to halt this disease.
Other questions? Ingrid?
Yes, okay, so this question is for Dr. McNeil and Mr. Gonzalez. Earlier we were talking about, being out in the community if you do show some symptoms, but are you still contagious if you're not showing any symptoms at all?
Well, that's been a big question. At what point is a person able to shed the virus? So some of the studies have shown that people shed this virus prior to developing symptoms, but that is not really very common. And that's why the CDC guidelines are pretty straightforward. They say that if you exhibit any symptoms, and from what I understand, fever is typically an early symptom. So fever would be my trigger, cough, and certainly any shortness of breath. Usually the shortness of breath comes after the coughing.
Okay, thank you for clarifying.
You agree?
I'd also love to hear more about what sort of exceptions or just any details that might be with a potential stay-at-home order or a shelter-in-place order. What might that look like for people?
Yeah, well, I guess I would put the title of the document aside, whether it's shelter in place, stay home, work safe, stay home, stay safe. What it is we would be changing and what it is we would be trying to accomplish. Certainly, if in the effort to slow the spread of COVID-19, you, for example, cut off somebody's access to groceries and medicine, you haven't done anybody any favors. That's clearly there are those essential things that will always have to be available. But even beyond the clear and the obvious things, I mean, certain industry, certain types of businesses are largely exempted and excluded in other jurisdictions' orders. That list is very wide, very broad, and I'd say open to wide interpretation. I've been very averse to this concept of something like this due to the fact that it could just open up more confusion than is necessary without achieving a goal that we're already achieving. I mean, I think the effect of what we're doing now, the effect of what we have in place is, I think we're on track, I guess is what I'm trying to say. When you look at the desired result of some of these stay-at-home orders, I think we're largely achieving that now. Could what we have in place be tightened a bit? It could be, but until there's the compelling reason on why it should, I think we're on the right track.
Well, I'm totally satisfied with what we have in place right now, because under our orders, there's certain things that we can do, that there are enforcement mechanisms through those orders, but there are also enforcement mechanisms in place through our health authority, who has the ability to take specific actions in specific circumstances. And I think people need to understand that as well. And that's kind of a second level of authority. And I can tell you that we actually received, I got a communique this afternoon for what the state is putting out about kind of the authorities that health authorities have. And we, in our own preparations, have already covered all the areas that they were talking about. So we were doing this last week, and Dr. McNeil knows what his authorities are and everything. So we're ahead of the curve there too, so.
What other questions might there be?
Yes, you've talked about how important isolation is at this point. And for the most part, the community's doing a great job about that. But would love to hear more about that from you, about why that's so important right now. If anyone is maybe thinking about cheating the system or maybe thinking they can get away with it, why is it so important for people to self-isolate right now?
Dr. McNeil?
You know, I saw a very compelling video that I've shared with the people up here, and it talked about the spread of this disease. And I'm going to tell you the numbers that they came up with in London. If you have the flu, specifically talking about this disease, typically if you have the flu, you will transmit that virus to 1.3 to 1.4 patients. That means after 10 cycles, in other words, going through 10 groups of people, that about 14 people will catch the flu. COVID-19 is much more contagious. And what the research shows is that typically, if you have COVID, you will pass it to 3 people. It does not seem to be much of a difference between 1.4 and 3. But if you go through 10 cycles with COVID, you will pass this disease on to 59,000 people. So you can see the difference, and that's why. And really the only thing that you can do to stop this from happening, you can't do anything to tell the virus not to jump out of your body and go somewhere else. So the only thing you can do is not give it the opportunity, and that is done through isolation.
And you know, that being said, is there any direction or any more advice that you could give to employers who might be asking their employees to come in to continue working? What sort of businesses might it be better for employees to stay at home?
As simple as close contact. I mean, what we're talking about is social distancing. And we've been good about social distancing now, even here. So avoid crowds, social distancing, and for God's sake, if you're sick, stay home. And wash your hands.
Doesn't it seem contrary, though, to keep the mall open, you know, in saying that, like, to encourage social distancing, but to keep the mall open? Like, shouldn't we as city leaders do everything we can to discourage that? Is the mall not for gathering?
Well, you know, that's a good question. But the difference here is community transmission. We have mild, if any, community transmission right now. I can rest assured that everyone at this table feels pretty sure that that will change if we get moderate to severe transmission. Did I answer that okay, Judge? That's kind of a-
Yeah, well, and I mean, for those businesses that are able to remain open and still be compliant with the 10-person limit in a single space, a single room, a single area, and have the 6-foot distancing, for those businesses that are able to adhere to that, we don't see a need to change what we have in place. But your point is well taken. And in implementing something like this, it's always a difficult balance to address every scenario, every circumstance, everybody's individual setting. But currently, there are a lot of businesses who are able to remain open while being compliant with the orders that are in place.
Right, I just meant like a facility like the mall, you know, where it's created for public gathering and commerce.
Well, I think now if you look at the mall, if you even look at the traffic outside, you'll see that a lot of people have already adhered to this, and there is a lot less going on in the city. And I think, to be honest with you, most people don't want to be closer than 6 feet to the next person. And that's a good thing, right now.
Yeah. Other questions?
Did I hear correctly that contact tracing has been completed on the 3 confirmed patients in Victoria County?
The high risk right now, that initial really highly critical investigative piece has been completed on those 3 patients. There's still other low risk and other possibilities that are still ongoing, and that's gonna keep going throughout the stages of the illness with these folks. So that is, the investigation is still ongoing, but the initial high risk part of the investigation is completed. There's several stages to it.
And I guess the latter part of that investigation, are we going to seek to reach out to these low risk potential contacts?
Yes, if they deem, I guess, necessary that they may be a little, that they're low risk, medium, or even high, if they find out some more, get some more information as this investigation progresses, then they'll definitely reach out to those folks.
All right, and what might be a high risk contact and a low risk contact?
If you can repeat the question.
Oh, sorry, George. Yeah, sorry, apologize. John's asking regarding the investigation with these cases, high risk, low risk contacts during the contact tracing investigation. High risk contacts is going to be those folks who are extended periods of time during the heightened part of the illness where they were contagious. Close contacts within, obviously 6 feet of each other or closer, and then being around them extended periods of time. Those would be the high-risk cases. A low risk would be maybe in the same building or something to that effect at any point in time, where chances are you're not going to have, not going to be exposed via the respiratory droplets that we discussed, in the weeks previous to this as a transmission piece. At some point, then there may be some transmission that took place, but it may be highly likely that it didn't take place.
And can we estimate when these 3 people might have contracted the virus? And what might that say about their near future with other people being diagnosed?
Yeah, John asked a question about do we know when they contracted the virus and what kind of information that, I guess, proceed after that. I don't have those details right now. Again, some of those parts of investigations are still ongoing.
Okay, maybe if we can take one more question. I know we've gone a little long today.
I've got one. Do we know, are we able to yet predict whether the social gatherings order signed last week will continue past the April 3rd deadline?
And I'll get our medical folks' feedback. At this point, I would say it's difficult to tell, being that things have been changing hourly, not just day to day, but hourly. I don't think any of us would be able to predict what next Friday will look like. You're correct. Currently, the order in place is set to end next Friday, April 3rd. Will there be a need to continue that to any extent? At this point, I would not want to guess what next week might look like. My hope certainly would be that we would not need to, but given the circumstances we're in, I don't think that's a guess that we could accurately take. Yeah, okay. Well, we again thank everybody for tuning in. Thank you for being here. I want to remind folks to follow the most current information on the Victoria County Public Health Department's Facebook page. Our website is victoriatxoem.org. The COVID hotline remains 361-580-5796. Following the closing of this briefing, a recording will also be available, also be aired on Q92, Jack FM, Club, and Kick stations. Those with unmet needs such as food, are able to call 211 to be connected with resources. We thank you for your time, and we will be back here at 3 o'clock tomorrow. Thank you.